Hi everyone, my name is David Villar, Professor of Pharmacology at the University of Antioquia. Welcome to this second presentation on adjuvants of anesthesia. Here we will address the clinical effects of opioids, and as you will see, they extend beyond those of simply providing analgesia, and knowing them will help us select one or another within this group. Just remember that even though pain management is probably the most important clinical application of opioids, in medicine, pain can also be abolished with other drugs. And as we talked on the previous video, a combination of drugs that work at different levels on the pain pathway is always should always be considered for a more efficient control of pain. If we start by recalling history, the word opioid derives from the plant where they originated from, which is the poppy plant, apparently a major cash crop in Afghanistan. And we can use both the word opiates when we refer to the naturally occurring alkaloids like morphine or codeine, or the word opioid if we include the synthetic or man-made compounds that behave similarly. For those of you wondering, morphine gets its name from the Greek god of dreams called Morpheus, which, as you know, has been used in fictional characters for those of you that follow the Matrix franchise. So as you can guess, these are drugs that make you sleepy in medical terms, and those drugs that capable of inducing sleep are called narcotics. However, the word narcotic in legal rather than pharmacological context refers to a variety of drugs of abuse, which, for example, include cocaine, and this one will definitely not put you to sleep. Now, in order to make the best selection of which opioids to use, it is important to become familiar with the clinical effects they may have on the body. This is a really large family of drugs that can affect just about every organ system to a different extent. And some of those effects may go hand in hand, like, for example, sedation and analgesia. And that may be desirable for surgical procedures, but may not be so if all you want is to create analgesia without sedation. And I'm thinking of the treatment of chronic painful conditions in patients with cancer. So there are opioids that will have multiple effects, like most of the pure agonists, and there are certain ones that will cause very unique effects, making them useful for maybe just one medical purpose. And I'm thinking, for example, of the antidiarrheal opioids like loperamide or difenoxylate, or for example the antitussive dextromethorphan, or for example the emetic like apomorphine. And to make things more complicated, there are effects which are contradictory, as you see here. In other words, sedation and dysphoria are almost the opposite, just like meiosis and mydriasis, or for example hyperthermia and hypothermia. So how come that some of these drugs can create entirely different things? To be honest, I don't have a good explanation for this, but I will tell you that whether one effect or the opposite happens is probably going to depend on the individual, the species, the presence or absence of pain, the health of the individual. For example, cats as a species are more prone to become excited with pure agonist instead of sedated. However, when we combine opioids with tranquilizer, they get better analgesia or better sedation than when we use either drug used separately. I came across this picture of 5 cats. I don't know which drugs they were given, but as you can see, they responded differently, which is what you may see with opioids. The cat on the left has obviously a pupillary dilation. Looks like you just saw the devil. The middle one seems really agitated, and the other ones seem kind of drowsy or sleepy. Now, the other thing is some people mistakenly consider a state of euphoria with agitation or being really hyper or active. And in reality, euphoria refers to a state of intense happiness or joy, which is not necessarily associated with excitement or agitation. In fact, the opioids, for the most part, create a state of sedation. In other words, they kind of slow down the brain activity, and at the same time, they create a feeling of well-being or happiness, which is the reason why humans easily become addicted. And in fact, the street name for poppy plant is joy plant, as you probably all know. Now, there are some animals that will become dysphoric under the influence of opioids, and we can now say that yes, this is a state of agitation in which the dog may be vocalizing, panting, non-responsive to human contact, struggling, and as you can all imagine, it can be easily confused with a state of extreme pain when they wake up from the anesthesia. And in reality, they might not be painful at all, and it's just another adverse effect of opioids. Now, the adverse effect which is feared the most is the respiratory depression. But this is really a misconception in animals, because it's basically humans that are notoriously sensitive to this effect. What happens in dogs, which would be more common, is panting because of the resetting of the thermoregulatory center. And another clinical effect which may be desirable is to suppress coughing in situations, for example, like the kennel cough in dogs, which is basically a non-productive cough and may end up being harmful instead of beneficial. And there are specific opioids like butorphanol or codeine that are particularly efficient for this effect. Now, with regards to the gastrointestinal effects, these are interesting because they can be also desirable or adverse depending on what you want to accomplish. If what you want is to induce vomiting, apomorphine in dogs is very effective, but unfortunately it's also probably the most common side effect of morphine and hydromorphone. And that's the reason why the antiemetic Cerenia, which is maropitant, is typically given before the prior to giving morphine in surgical procedures. Now, it's also one reason why fentanyl that penetrates the emetic center a lot quicker than morphine is used, and by the time that chemoreceptor trigger zone is stimulated, the emetic center is already depressed, so the animal will basically not vomit or have nausea with fentanyl. Now, the downside of fentanyl, which not happens with the other opioids, is that it causes bradycardia during the anesthesia, and sometimes you may need to use atropine to reverse this other side effect. So as you can see from what I'm talking, every opioid has peculiarities that make them different within this group. And we will try to cover this in more detail in the next video because they have obviously clinical relevance on whether you may want to choose one or the other. Now, with regards to the induction of constipation, it's obviously an adverse effect unless you want to stop a diarrhea. If you use a pure agonist during surgery, a postoperative ileus is always a possible adverse effect. So you may need to reverse it with prokinetic drugs like metoclopramide. However, if you want to stop a diarrhea, there are specific opioids like loperamide or difenoxylate that are basically exclusively used to treat diarrhea. They do not have really any other clinical indication, and they work by increasing those segmental contractions in the circular muscle layer of the intestine. And when that happens, that kind of has an opposite effect of the propulsive or forward movement of the ingesta. Now, another interesting effect, one that are changes in the pupillary diameter, and this also varies depending on the species. Again, two opposite effects, and on this occasion they tend to be very species specific. Dogs and humans tend to get meiosis, whereas cats, ruminants, and horses develop mydriasis. Next, we have the effect of temperature. This usually happens by the release of serotonin in the hypothalamus, and which may also explain some of the excitatory actions. And usually what happens is there is a resetting of the thermoregulatory center, and when this is done to a lower level, for example in dogs, it causes hypothermia, but it does exactly the opposite in cats, horses, and cattle. They tend to exhibit hyperthermia. And finally, it's worth mentioning that opioids can increase urethral sphincter tone, and that can explain some of the difficulties urinating. And when this happens in the postoperative period, you may need to help the animal express that urinary bladder. So this is something that always to keep in mind. You may want to know that the animal is urinating and defecating normally before being discharged from the hospital, because as you can see on those images, one of the side effects of opioids are constipation and urinary retention. Now that we have pretty much seen what the main physiological effects are, by default, the clinical applications of these drugs can also be deduced. By far, the main use of the whole group is towards providing analgesia. When combined with tranquilizer, they create what's called a state of neuroleptoanalgesia, which is really the ideal combination in the pre-anesthetic step of any surgical procedure. And if you remember what we said on the first video, the analgesia is always more effective if you give it before the pain has built up to a higher level. And the administration of opioids will definitely go a long way to achieve a state of balanced anesthesia, which is really what you want throughout any surgical intervention. And I should also mention that another major application of the opioids is their use in or injections in the epidural spaces of the vertebral canal. This will not only avoid many of the side effects of giving the opioids by parenteral route, but will also prolong their duration of action. So definitely another benefit is that you will need less drug altogether. Apart from the analgesia, there are some miscellaneous applications that are worth mentioning, and for which specific opioids truly work. For example, the antitussive effects apply to three drugs: codeine, butorphanol, and dextromethorphan. To induce vomiting in dogs, we use apomorphine, which is considered the most effective centrally acting emetic. It shouldn't be used in cats. To treat certain types of diarrhea, there are two specific opioids that are diphenhydramine and loperamide. And finally, if you happen to work with wildlife animals, there are two opioids that are extremely potent and will basically knock down any running animal to its knees. Their names are etorphine and carfentanil, and these are basically the drugs that you will see being used from the air when they want to capture an elephant, a rhino, wild beast, and so forth. There is one thing I wanted to end up this presentation in, and that's by mentioning that opioids are drugs which tend to create tolerance on the long run, and that usually goes hand in hand with physical dependence, which means that when the effect of the drug wears off, the body experiences withdrawal reactions, which are exactly the opposite of what the drug causes. So if the drug is, for example, causing meiosis, without the drug, the body will now exhibit mydriasis. from causing constipation, now we'll have diarrhea. Sedation will become restlessness. Euphoria will basically turn into depression. In other words, people go through a roller coaster from being really on top of the world down to being in hell with the devil, so to speak. And then from having analgesia, they will now experience pain. So, in summary of everything we just said, opioids are a really large family of drugs, and we need to select them based on the desired effect that we want to achieve. The ones that will cause less side effects, and obviously cost becomes an issue many times. It's difficult to predict many of the side effects, so we need to be prepared always in case we need to reverse them. Naloxone is one of the drugs that we can use. And we can also counteract some of the effects, for example, of constipation with metoclopramide. And always remember that the drugs used for non-analgesic applications usually have very little or no analgesic effects. And I'm thinking of, for example, the antidiarrheals or the emetics or the antitussives. So having said this, I will dismiss you now, and on the next video we will address basically the peculiarities or specifics of each one of these opioids and discuss which one might be more useful to use depending on what you want to accomplish. So having said this, thank you for watching, and bye bye for now.